Hello, I'm Dr. Rohini. Today I'm going to talk about how we are going to manage a woman with high sugars in pregnancy. So the basic investigations that are done are going to be little different for the two categories of women. The first one, that is women who are already diagnosed with diabetes. For them, it is important that we do a retinal screening. So they have to be checked by an eye doctor or an ophthalmologist because high blood sugar over prolonged time can affect your eyes, your vision. And then second, their kidney function test also has to be checked because prolonged high sugars can also affect your kidneys function. Apart from this, we would be checking glyco-HB, that is HbA1c, and also random blood sugar and fasting blood sugar is usually checked. Now, in women with the second category, that is GDM, in them it's not necessary that we do all this eye screening and test for kidney function test, but it's important that we check for infection. We do a complete blood count, we check total counts, and also we check urine test in both these women every month to rule out urine infection, because these women are prone to all kind of infections. So this is the blood test. Now second, in these women it's important that we do scanning regularly. So the first scan, that is NT scan, that would give an idea if baby has any brain abnormalities, and the other important scan, that is the anomaly scan or target scan, that is done at 5th month, that also gives an idea if baby has any heart abnormalities or any problem in brain development, which is common in women who have pre-existing diabetes. Now the importance of scan in women with GDM. So what happens is, in both the category of women, the baby tends to be big. So it's important that serial growth scans are done to see the weight of the baby, to check the water around the baby, because this would give us an idea whether the blood sugars are under control or not, and also it would help us in planning delivery for the woman, because if the baby's weight is more than 4 kg, ideally it's advisable not to to allow the woman to go for a vaginal delivery, because at the time of delivery the baby's shoulder can get stuck. There may be shoulder fracture, there may be other injuries to the baby. Baby may require an ICU admission because of breathlessness, or sometimes in very rare scenarios the baby may even die during the process of labor. It's very important to monitor the baby's weight and growth. And also when women who already have diabetes mellitus, their babies can sometimes be smaller than usual also. This paradox can also happen because of very high blood sugar from the first month of pregnancy. It may affect the blood supply to the baby and the baby's weight may be smaller. In that case also, we may have to plan an earlier delivery. And other than this, the third monitoring would be that we would tell the mother to monitor the baby's movements. It's very important because in uncontrolled sugars, one of the complications is that there may be sudden intrauterine death. That is, the baby may die inside the uterus. So it's very important that the mother monitors the baby's movements during her pregnancy. That is, usually we advise her to do that after 28 weeks, that is in the after 7th month of her pregnancy. And then other than this, we have to routinely monitor blood sugars to see if the sugar level is in control. So now how are we going to monitor blood sugar levels once the patient is already diagnosed? So to monitor that, first we have to see blood sugars fasting levels, and after every meal, that is breakfast, lunch and dinner, either some people recommend after 1 hour or some may choose to check after 2 hours post meal. So these 4 values have to be checked, and they have to be checked at least once or twice in a month, even if your sugar levels are under control. And these have to be checked much more frequently if your sugar levels are not under control. So now what is the ideal blood sugar levels that is expected? So when you check fasting levels, fasting should be less than 90 milligrams per dl. And post meal is usually expected, if you're checking 1 hour after the meal, then we expect a value at around 120 to 140. And in case if you are checking after 2 hours after the meal, then the control best would be around 110, but even up to 120 is acceptable. So now I have told you how we are going to monitor a patient with high blood sugars in pregnancy. My next video would be about how we are going to go about the treatment part.